morning, it's October 21st. This is to my liberal friends. There's an old adage out there that's very pertinent today. How do you know when a politician is lying? When you see his lips move. Well, nothing will be more true today when you start discussing the shutdown and the showdown over funding the government. And unfortunately, it's the Democrats who are conflating the truth more than Republicans. And the real problem is they know they're misleading the public, and yet they go before cameras in the media and on the Senate floor and do it over and over again. And I'm talking about the issue of health care. If you listen to Democrats, if the Obamacare subsidies are allowed to expire at the end of the year, remember it was Democrats that passed the bill a couple of years ago that put that expiration date in place, then health care premiums under Obamacare would more than double. If this were actually true, it would be a scary thing, but it's false, and they don't want you to know that. The first thing you have to ask is, where did they get this information in the first place? The source, as it turns out, is a study done by KFF, formerly the Kaiser Family Foundation. The researchers there published these numbers, made a major mistake, but Democrats don't want you to know about that part of the equation. On August 6th, KFF published an analysis showing, quote, a median proposed increase of 18% for insurers' exchange plans. But on September 30th, several of the same researchers issued a second report with a headline asserting that, quote, premium payments would more than double if enhanced subsidies expire. What happened? Did premium estimates for 2026 rise sixfold in 1 month? No. KFF's second study was misleading. It used cleverly parsed terms, premium payments rather than premiums, to conflate total premiums with enrollees' out-of-pocket payments. The two aren't the same. Focusing on the latter to the exclusion of the former, as the September study did, omits an important context to the whole issue. And guess what? The researchers knew they'd made a mistake, and a KFF Vice President, Cynthia Fox, acknowledged when asked that the claim was inaccurate and they planned to update the information to be more precise. They did this, but did not advertise the change or the mistake, and Democrats kept using the earlier one while ignoring the correction. Now, according to KFF's own work, it shows that the federal government will still pay the vast majority of most enrollees' premiums, even if the enhanced subsidies, which were enacted by Democrats in 2021, and slated to expire this year, even if they end. In a July analysis by KFF, they found that the enhanced subsidies paid an average of 88% of the overall premiums. Now, if you take away the subsidy in question, the government will be paying 78% of the premiums. Other experts who do this similar analysis have confirmed that federal dollars will continue to pay the lion's share of most enrollees' premiums, even if the subsidies expire. They're going to pay the vast bulk of it. The real issue that's being masked by Democrats is something that the Biden administration did in 2021 with the support of congressional Democrats. Under the original Obamacare plans, the subsidies were limited to 400% of the federal poverty level. This was done so the truly needy in our country would get help in paying their premiums. But the Biden administration lifted that income limit. If the subsidies were to expire, those with higher incomes would see their health care costs increase, but even the KFF data shows that's only 7% of the enrollees, not the numbers the Democrats are throwing around. The Urban Institute, another liberal group, estimated that the uninsured rate among this group would rise only modestly because they are more likely to pick up coverage from their employer. This is another factor Democrats don't want to focus on. Since 2020, we have seen a drop in the number of people who are choosing their employer-provided health care plans and choosing to take the government subsidy because it's financially better for them. This is against the rules of Obamacare, but it hasn't been enforced. The Congressional Budget Office estimates that 2.3 million exchange enrollees improperly claim subsidies via intentional overstatement of income this year, allowing the free benchmark coverage provision to lapse. Requiring households to pay something toward their health insurance seems necessary to combat fraud. Allow me to explain why people would deliberately overstate their income. When the Democrats lifted the income limits, they put in place a rule that your premiums could not exceed 8.5% of your income. By overstating their income, it kept their premiums below that percentage and allowed them to get their health care premiums paid for by the government. And I think we also have to be honest about health care premiums overall. Mine are going to increase, and yours will increase as well. As an example, if you're on Medicare Part B, that's the plan, part of the plan that picks up doctor visits, your premiums are going to rise about 12% this year. And your out-of-pocket expenses, deductibles and copays, are going to increase as well. It should be obvious to anyone looking at these facts that Democrats are using this ruse on health care to scare people, relying on the belief that very few people understand how these premiums are calculated and how the subsidies are paid out. The left's apocalyptic rhetoric about the expiration of the enhanced subsidies belies that federal taxpayers will still subsidize 3/4 of enrollees' premium costs. KFF's misleading data about premiums doubling echoes the maxim of not letting a good crisis go to waste, even if one had to use deceptive rhetoric to overstate the supposed crisis. Taxpayers footing the bill for Obamacare subsidies shouldn't be fooled by the scaremongering of the welfare complex dominated by Democrats. This has been To My Liberal Friends. Thanks for listening.